Hi guys, 20. What's up? I don't know. It's raining where I'm at, and my stuff is still running slow, even though I got it straight from the computer Ethernet cord to the booster. So I don't know how much better I can do than this. Um, I'm sure this is going to be a demonetized video before, even though I've got all of my sources and all of everything down tight. The way I like to talk about things, usually I end up being demonetized. So I'm not here to scare you away from taking the vaccine. I'm not here to encourage you in taking the vaccine. I'm just here to be honest about it. Like I'm here to compile all of the things that are being said about it, since it's a very, 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 very new vaccine, into one little video. Yeah, it might be a little scary because it's a lot of information at once. But go back and look at the chickenpox vaccine and the polio vaccine and the measles, mumps, rubella vaccine. Those those things had side effects, and flu vaccine. I mean, pneumonia vaccine. All of these vaccines have other issues. There'd be skin reaction. Sometimes you get real super sensitive skin in the area of the. We'll get to that. Okay, guys, let's get to business. Shrink it. There we go. Yes. All right, all right. Let's start with something we've probably been hearing a lot about is different people having reactions to different brands. Yes, there's multiple different brands of vaccines. Moderna, Johnson and Johnson, Pfizer, AstraZeneca, and then numerous other ones made in every single country that's got the ability to make their own vaccine. So this man, let's take a look at this. All right. My video booster on. Let me just check. Voila. Okay. So anyway, this man, a New Jersey man, has been in the hospital with COVID 5 weeks after being vaccinated. Now, isn't this a story you keep hearing from people? My mother was vaccinated on the 1st, and now here it is the 9th, and she's got it. It doesn't work. That's or I know this girl who got vaccinated last week, and 3 days later she had COVID. She got COVID from the vaccine. I don't think that's true either. I think that very likely when she went to get her vaccine, she had already been exposed to COVID, and she was incubating the symptoms at the time because it takes like an incubation period, incubating the virus at the time. And therefore, ironically enough, she had COVID while getting the COVID vaccine. But anyway, it says Francisco Cosme was ecstatic when he booked an appointment for his one-dose Johnson and Johnson vaccine at the Javits Center on the 6th. Cosme was vaccinated. He continued to wear a mask and followed social distancing guidelines, but became very confused and doing things that were not normal. The 31-year-old father drove to a clinic where he tested positive for COVID-19 and was instructed to quarantine for 10 days. Here he is, fully vaccinated, ends up in the hospital on a machine, machine to help him breathe. You're gonna hear this. It's gonna happen. It's gonna happen a lot. I'm gonna show you a couple of different examples, but it's not one thing didn't lead to another. His vaccine did not lead to coronavirus, and him being vaccinated didn't him getting the coronavirus doesn't mean the vaccination wouldn't have worked had he not already been exposed and had it. See, there should be a way to be able to tell if you're incubating the virus prior to vaccination, but there's just not. So, on to the next one. New York Post. Now, here when I was talking about skin reactions, this is where we're going to see some skin reactions in this one. I almost burned that. Man's skin peeled off in rare reaction again to now this is the second one. We're going to hear, like I said, in each story, they're going to refer to a brand of vaccine. You can figure out yourselves what vaccine has, we're going to talk about the side effects with all of them, but you may hear one brand more than the other just because that's how this worked out. Okay. Richard, oh, no camera. Why? I was just on it. All right, whatever. Anyway, Richard Terrell suffered a severe rash over his entire body. Now, that's not normal. I'll give you that. Because normally, as a nurse, I would say I mostly saw when I would do help with like vaccination, flu vaccines and pneumonia vaccines, I would see mostly irritation in the injection spot. So like if we injected it in the shoulder, there might be like a red circle, swelling, what do you call it? Sometimes like a rash, if it would feel hot. He says, I began to feel this little discomfort in my armpit, and a few days later, I got an itchy rash that began to swell, yep, and turned red. But soon, didn't see a lot of times with rashes, people itch and it just spreads it, but not all over your whole body. Soon, the rash covered his entire body. It just happened so fast, my skin peeled off. Boy, doesn't that make this sound terrible? COVID vaccine made my skin peel off. Now, can you correlate the fact that this man got a COVID vaccine and within a certain amount of days, he had a rare skin reaction that caused this rash? Check it out. Stinging, burning, itching. Whenever I bent my arm, you can tell he's filled with water too. Not only did he get a rash, but he's got enormous edema in both legs. He's just underneath his skin is just nothing but water, which is what's causing all this peeling to take place. Uh, that's why when he says he bent over, it hurt. Okay, so he went to the ER at the hospital where the doctors determined he had an adverse reaction to the vaccine. We ruled out all viral infections. We even ruled out COVID-19 itself. We made sure his kidneys and liver were okay. And finally, we came to the conclusion that the vaccine that he received was the cause. She said the medical episode could have been life-threatening if left untreated. Skin is the largest organ on your body, and when it gets inflamed like his was, you lose lots of fluids and electrolytes. That's what I'm saying, because he's filled right up with it. He's filled up with fluids. So Newton emphasized that those such reactions are extremely rare. Understand this, people. Extremely rare. There's a not another probability that I would say in the news you will see reported anytime in the next 10 years about a man or a woman whose skin peeled off their entire body after taking the COVID vaccine. I believe this is a one-time thing, and it has to do with, A, B, and C added up in this man's, in system, and it caused this reaction. It says if you look at the risk for adverse reaction for the vaccine, it's really, really low. Yeah, okay, so that's what I'm trying to prove, but it's hard to prove it when you have articles that are strategically out to scare you. Like man's skin peeled off when he took the COVID-19 shot. Excuse me. How about this one? Okay, republicworld.com. Hank Aaron death. MLB legend shockingly passes. Why is the camera suddenly not available? Anyway, shockingly passes away weeks. Let me move this then. After taking the COVID vaccine. Hank Aaron, one-time home run king, took a coronavirus vaccine. Now get this, guys. Listen to this word. weeks, weeks before his death. Oh, look, now the camera's available. Anywho, uh, yeah, let's check it out and see exactly how long. Atlanta Braves legend Hank Aaron breathed his last on Friday, January 22nd. My son's birthday. Happy birthday, Kyle. Regarded as one of the finest baseball players of all time. By the way, today is April 16th. My oldest, Alyssa, is 23 today and is very, very far along with my very first grandchild. Happy birthday. Back to business. Aaron eclipsed Babe Ruth as home run king. He died at age 60. Hank Aaron, cause of death. How did Hank Aaron die? In, in a Hank Aaron death official statement, the Braves revealed that the legend had passed away in his sleep. No details on how Hank Aaron health or his cause of death were disclosed. A little over 2 weeks before his death, so a little over 14 days, the Hall of Famer got vaccinated for COVID-19 in Georgia, hoping to send a message to Black Americans that the shots are safe. And then it says, Aaron, at the time, told AP he had no qualms about getting vaccinated. He was proud of himself for doing so. It was one of the greatest honors of his life. Oh, that's somebody else saying that while paying his respects. But anyway, my point is that at 14 days plus before his death, he took a COVID shot. Do you really believe that that COVID vaccine played any part in his death 14 days later? After seeing that man whose skin peeled off, there goes the camera again. After seeing the man whose skin peeled off, did it within, 3 hours of, he started within hours of having the vaccine, right? So again, when you have a headline like this, you have just erased in a group of people from the population, maybe baseball fans, maybe Hank Aaron fans, maybe just Black people in general, maybe just people who are looking for a reason to not trust this vaccine, any way, shape, or form. The way I put it, the way I look at it, this headline totally meant to scare people. Fear, fear, fear. Don't get the vaccine. It's like you got all these dumb commercials and all these celebrities and all these politicians and all these people that I don't give a about telling me take the vaccine, and you do what's right for you for your community. Blah 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 blah. And then you have these fear mongering headlines to scare me the fuck out of it. It's a catch 20. It don't make no sense. It doesn't make any sense. Keep going. It didn't say which vaccine he took either. I was looking to see if it said the brand of vaccine he took. It doesn't say. It might in another article, but it doesn't in that one. Blow my nose. Oh, I gotta get tissue. California ER nurse. Okay, here we go. Now we're getting a little bit more into the weeds. California ER nurse tests positive for COVID a week after getting the vaccine. Okay, a number of things are at play here. One, she's an ER nurse, meaning he's an ER nurse, meaning he's got, you know, contact or close contact and numerous close contacts with other COVID positive patients who have come into the ER. And hopefully he's using his PPE or whatnot, but you never know when a person slips up, forgets to wash their hands, touches their face, whatever. So the experts say the timeline's not unusual. Okay, so now the day he got the shot a week ago, he very well, his immune system could have been low, whatever. He could have already been, he had the exposure, he could have he could have technically already, yes, he had to have been, excuse me, yeah, he was in the incubation period. If he got the vaccine 7 days later, he was positive, then he already had the virus when he was vaccinated. Um, this says the 45-year-old nurse felt sick after working his shift in the COVID unit 6 days later. Okay, so that's 6 days after taking the vaccine. That means he was exposed to COVID, and it's been incubating in him for 8 days prior to that. Do you understand? Like up to 2 weeks. So these headlines are completely useless. They should just all say California nurse was already positive for COVID when he got his vaccine. So he tested positive a week later. Yay. But they don't say that because that wouldn't get you to click. What else? A lot of these are the COVID after the vaccine. We're gonna get to the blood clots. Don't worry. I've kind of got them in order of, how bad the symptoms are, whatever. Did they get COVID? Did they get a rash? And so on, and going up the scale. Long Island woman. What's it happened to this? Again, New York Post. Long Island woman. This is the Moderna one because this was a 2-dose, right? Yeah, because Johnson and Johnson is a single dose. Moderna is a 2-dose. So a Long Island woman tested positive after her second dose. How is the schedule on the Moderna vaccine? She started experiencing symptoms shortly after finding awake, unmasked, of course. Yep, 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 yep. There were probably at least 10 family members. I hung around for an hour without wearing a mask. I hugged each one of them. It was a funeral. You really can't blame her. A few days later, she had symptoms. She later learned 3 family members who had attended the gathering tested positive for COVID. Excuse me. I feel like I got it. No, I'm just kidding. You guys already know I already had COVID. Probably going to get the mutant. Well, hello, camera. Nice to see you again. Just decides to come when it feels like it. None of the vaccines approved for use currently offer 100% protection. We all need to hear that. None of the vaccines currently approved offer 100% protection. But they do help. Don't get me wrong. Rosen's infection is a rare case of a person coming down with the illness following the inoculation. Some experts say it's unlikely, but still is possible. Rosen ultimately fought off a mild bout of COVID-19, but is thankful she was able to get the vaccine. You can still get it. You can probably still spread it, and I want people to know it's not over. So basically, she got it, but see, I don't really, I don't believe it because how long after the funeral? Okay, or after the shot? Oh, it was a whole month. It was a whole month after getting her second dose. Total failure of vaccine right here, guys. This is a case of a failure of a vaccine, which is why the medical professionals said this is a very rare case where a vaccine failure took place. She came down with the actual virus, not a mutation, the actual virus after being inoculated properly and after over a month, almost 2 months from being inoculated. That is a failure of vaccines. It happens. They're not 100% positive. So, good example. Oh, it's chilly in here. I'm going to we've seen a lot of these, so I'm going to hot past a couple of these, but I do want to talk about, this is not necessarily, what do you want to call it? A mainstream source. But the weird thing is, it took CatholicCitizens.org for me to bring me attention to this there's no attention on this article at all, which scares me. It makes me feel like, okay, why is it that the only people reporting on this are the people that most people would find to be like extremist, right, whatever. Okay, I don't know why the camera's still not on. It'll catch up though, right? So 55 people in the US have died after receiving a COVID-19 vaccine, according to reports submitted to a federal system. This is where things get a little bit breathe. Come on now, we've got how many 100 million people have taken the vaccine? Isn't Biden shooting for his 200 million or some shit like that? Okay, 55 is not a huge number, and it's only here in the US. So, deaths have occurred among both people receiving both Moderna and the Pfizer vaccine. Now, mind you, this is January 16th. I don't know if Johnson & Johnson was okayed yet. So that might be why they don't have, or maybe it's not been okayed long enough yet. So I don't know if that, I guess that's why they only are reporting on these two. The reporting system, known as the Vaccine Adverse Event Reporting System, the VAERS, VAERS, is a federal database. The system is passive, meaning reports aren't automatically collected and must be filed. VAERS reports can be filed by anyone, including healthcare providers, patients, or family members. VAERS reports often lack details, sometimes have information that contain errors, but according to the report, or excuse me, sometimes have errors according to the system's website. Still, they only represent a small fraction of the actual adverse events, though, because of underreporting. We all know it's, if you're a nurse, you know all about underreporting. So, in some cases, patients die within days of receiving a COVID-19 vaccine. Here's a couple cases. One man, 66-year-old senior home resident in Colorado, was sleepy, which we've heard this about the Moderna vaccine and the Pfizer vaccine. Sleepy, stayed in bed a day after getting Moderna vaccine, all day. I have a friend who stayed in bed for 3 days after getting her second dose. Early the next morning on Christmas Day, the resident was observed in bed, lying still, pale, eyes half open. Remember this part. Foam coming from mouth and unresponsive. He was not breathing and with no pulse. Another case, 93-year-old South Dakota man. This was Pfizer's. About 2 hours after he was vaccinated, said he was tired and couldn't continue with physical therapy, taken back to his room where his legs felt heavy. Soon after, he stopped breathing. He had a DNR. Oops. Do not resuscitate. Moderna and Pfizer did not respond to requests for comment. Abigail Capobianco, a spokeswoman for FDA, told the Epic Times via email, any reports of death following the administration of vaccine are promptly and rigorously investigated jointly by the FDA and the CDC. Oh, great. I feel wonderful about that. 1 minute. I need to go blow my nose. Oh, there we go. Okay. Thank you. Bear with me. I'm sorry. So, officials at the agency work with healthcare providers to obtain medical histories and clinical follow-up information and conduct clinical case review. It's important to note that it is generally not possible to find out from VAERS data if a vaccine caused the event. Remember, like in the beginning, or a couple articles ago, they went through a whole bunch of tests and they ruled out everything else, and then the skin guy, and then they said, okay, no, yeah, was it the skin guy? Yeah, they ruled out everything else, and it wasn't a virus, it wasn't it wasn't this, and then finally they said, okay, now we're going to say it's a result of the vaccine, an adverse event to the vaccine. It's a hair. Yeah, it's a hair. Anywho, sorry. Officials at the agencies. No. Deaths. In addition to deaths, people have reported 96 life-threatening events following COVID vaccines, 24 permanent disabilities, 225 hospitalizations, 1,388 emergency room visits. And it says as of January 15th, 10.5 million Americans this was as of January 15th, have received a COVID vaccine. It's up to like 100 million now. I know that, or something close to that. So one death following the vaccination attracted attention this week. Gregory Michael, a 56-year-old medical worker at Mount Sinai Medical Center in Miami, Florida, was injected on December 18, 2020. 16 days later, he died. That's an awful lot of days later, though. Michael's wife, Heidi Neckelman, said on her Facebook her husband was very healthy before being vaccinated. She said he was admitted to ICU with a diagnosis of acute idiopathic thrombocytopenic purpura, a blood disorder caused by a reaction to the vaccine. He eventually passed away. Okay, that's sad. It's sad. It's like sad. But that also is, I hate to say this, it happens in case of every single vaccine that's ever been made. Disabilities, death, hospital visits, all those things I just named off to you, those 24 permanent, 96 life-threatening situations, whatever. It could be anaphylactic, people's throats close up, they got to jab them with a pen, EpiPen. Those are all things that could happen in getting your flu shot. I promise you. I promise you. So, she says he was a pro-vaccine advocate. That's why he got it for himself. I believe that people should be aware the side effects can happen. It's not good for everyone, and in this case, it destroyed a beautiful life, a perfect family, and affected so many people in the community. Don't let his death be in vain. Save more lives by making this information news. Pfizer told news outlets in a statement that no evidence currently shows a link between his death and the. Of course not. 16 days, they're going to deny it to the day the cows come home. I mean, but he had the diagnosis of idiopathic thrombocytopenic purpura, a blood disorder caused by a reaction to the vaccine. There's no denying it. It's been diagnosed by medical professionals, Pfizer. So I don't know how you say there's no evidence, because the evidence is right here. The evidence is the diagnosis. We're actively investigating this case, but we don't believe at this time there's any direct connection to the vaccine. There have been no related safety signals that identified in our clinical trials. Post-marketing experience thus far are with the mRNA vaccine platform to date. Millions of people have been vaccinated, and we are closely monitoring all adverse events, including people receiving our vaccine. It is important to note that serious adverse events, including deaths, that are unrelated to the vaccine, are unfortunately likely to occur at a similar rate as they would in the general population. A Pfizer spokeswoman told the Epoch Times via email earlier this month that the company closely monitors all reports following vaccination. Moderna has not responded to the request for comment on its involvement in how it monitors serious adverse events in people who get its vaccine. The updated VAERS data came after Norway changed its COVID-19 vaccination guide to direct officials not to give very frail people one of the vaccine, citing 13 deaths among people who were vaccinated. Right. Now they've actually, when we get into the blood clot thing, they're kind of isolating that now too. Like, all right, well, we're seeing a lot of people get blood clots with these specific vaccines. Maybe we need to start not giving certain people these vaccines. Yeah, we'll get to that in a minute. I don't want to confuse you. AstraZeneca, the one that we all keep hearing about. All right, AstraZeneca, coronavirus vaccine, plausibly linked to rare brain clots. Now, I've actually seen these. I seen what do you want to say? I seen autopsy of a brain, and I saw them hold it up sideways, the slice of it up sideways. 1 second. And let me see here. Where is it? They held it up sideways like this. It was like and it was a slice of the brain. Because most people who die of coronavirus, like the one thing they ask their families is to have their body donated, because this is the first time we've dealt with this pandemic, so we want to see the internal damage caused by coronavirus so that we know what to look for pre-death. Okay, so this guy's brain, excuse me, he was an elderly guy, and he died of corona. He'd been on a ventilator for so many days or whatnot, but his brain had they were just everywhere, these brown spots. Like you could see where it started to go, and then they get to the end, and it was just like you could see where all the veins kind of exploded open, and then this brown material was like decaying that area. And they were everywhere, and their brain, like their blood clots, but they're in the brain. So anyway, medical regulators in Britain and European Union on Wednesday said it was plausible that Oxford's AstraZeneca coronavirus vaccine is linked to rare but sometimes deadly blood clots, a development that could complicate plans to roll it out around the world. And they did. I believe they actually held off on this for a couple of days. I don't know, maybe another extra week, or they were going to roll it out to 140 countries through COVAX, which, give me a second here. Let me just look around, because here we go. We kicked him out, I think. Oh, why is it going so slow?
The United States government is blocking AstraZeneca from using the Baltimore factory that botched 15 million coronavirus vaccine doses, and has placed its rival, Johnson & Johnson, solely in charge of the facility instead. That's according to a Reuters source, a senior health official. It's the latest setback for AstraZeneca, the British pharmaceutical giant, which had been previously criticized by the government for using outdated information in the results of its vaccine trial. It's not been approved yet in the US. Several major countries,
Come on.
including Canada, France, and Germany, have also limited use of Astra's vaccine while they investigate reports of blood clotting, although the reports are incredibly rare. Millions of people have already been inoculated with it. The Baltimore factory is owned by a company called Emergent Biosolutions and previously produced coronavirus vaccines for both Astra and Johnson & Johnson. The botched doses incident occurred several weeks ago when the factory reportedly mixed ingredients for the two different vaccines together in error. The New York Times reports that the Biden administration's move to oust AstraZeneca from the
Hold on. I wasn't prepared for that.
Times reports that the Biden administration's move to oust AstraZeneca from the facility was done to avoid future mix. The New York Times, two different factory reports with Johnson & Johnson. The botched doses incident occurred several weeks ago when the factory reportedly mixed ingredients for the two different vaccines together in error. The New York Times reports that the Biden administration's move to oust AstraZeneca from the facility was done to avoid future mix-ups. Last week, Dr. Anthony Fauci, the government's top infectious disease expert, told Reuters that the country has enough vaccines in the pipeline that it may not need AstraZeneca's, even if it does win approval.
Well, regardless, guess what? AstraZeneca is not the only one to have issues with blood clots. We will get to that. Oh, that got nice and warm over there, didn't it? It must be my battery did it. Wow. That one got me. Okay, so 60-year-old father dies after receiving his second dose of Pfizer's vaccine. Here we go again. This is, now get this. Listen to I love how they spin this again. Guys, these articles are unnecessary. Just give us the information without the bullshit fucking headline. There goes my monetization. I dropped an F-bomb. So help me God, I'll never get a video I get paid for. Excuse me. Damn vape. 60-year-old Orange County man died after receiving. Okay. Anyway, let's see. It says hours after he got. Now, this is different, guys. Hours after he got his second dose, he was taken to the ER of a hospital where he worked. So he was an emergency room worker. Very well could have been exposed to COVID or been incubating COVID all this time. Got his vaccine. Oh, God. I don't want to read all that. That's just a big, I don't know. I'm not sure what to say about this case, guys. And I can't stop coughing, so I'm going to have to do my inhaler while I'm talking to you. I'm sorry. I should have never hit that beat. Can't edit this out either. The family's waiting on the. Okay, so it basically just says he fell into a coma and passed away after away 4 days after getting the shot. In total, he was so bad. He told them, "Put me on a ventilator. I want to live." Those were his last words. He had high blood pressure, but was otherwise healthy. Take the vaccine, please, he says. Okay, let's get a little funny. I joked around with my daughter's boyfriend about him getting the vaccine because I said, "You going to get your chip?" And he's like, "What are you? They're not gonna put a chip in the vaccine." I'm like, "Well, how do you think they're gonna? And how do you think they're gonna get the people who don't want to be vaccinated? They're gonna put microchip them through the vaccine, do it while they're having a surgery or getting their teeth pulled or all kinds of other things where people have necessary medical things that need to be done. Where, oops, so and so is unvaccinated. All right, well, when he's under, and they pop him. Now, the future's now, it says. Yes, it does. The Pentagon reveals a microchip under your skin that detects COVID before you show symptoms. Well, how are they going to do that? They would have to do what? They'd have to put it in the vaccine. Oh, where'd my camera go? Check it out. Pentagon. Pentagon, Pentagon, Pentagon. Never fails. Talk to me. Oh shit. Come on. Come on, spinning wheel. All right, I'll read it. It's just the garbage man. Do not bark at the garbage man. No. I'm recording. Anyway, so that's not going to happen. It says so. Close it. The device will be inserted under the skin in order to monitor your health, in turn detecting viruses, infections, and stopping COVID in its tracks. Small chip, I'm going to be inserted under the skin. Team tasked with making pandemics a thing of the past. Quote, I hate when they... DARPA, I was just going to say their name. DARPA, and look, it's 3 fucking paragraphs down. DARPA is part of the Pentagon. It's part of our DoD, Department of Defense, whatever. They're the Defense Advanced Research Projects. Anything that you can imagine, like Star Warsy, like iRobot, Star Wars, and Wally. Yeah, it's happening in DARPA. Like all them robots and AI and quantum computing and all those things are happening in DARPA. Okay, and a team in DARPA that was formed quickly, I'm sure, but quote unquote, their job is the team tasked with making pandemics a thing of the past. I don't know why I'm looking at myself instead of you. Making pandemics a thing of the past. Well, that's a little scary, don't you think? Like, I don't like the idea of when someone decides to step in and make and make their goal so lofty. Lofty little goal. Look at me. Anyway, the NHS says 3 most common coronavirus symptoms are new persistent cough. This just came from me hitting that vape, so don't give me no shit. High temperature, ain't had one. Loss of taste and smell. I wish. Live with 4 dogs and 3 cats. I smell everything. If you have any of these symptoms, you should get tested and isolate. But data has also found that people can suffer with symptoms such as headache and fatigue, with around a third of the population not displaying any symptoms. DARPA in the US revealed that the device could stop people unknowingly spreading the virus. But you would then be forced to be chipped. And once the chip is in you, I hate to say this, but it's a piece of software, hardware, software, however you want to look at it. That software can be constantly managed elsewhere. Somebody somewhere else is downloading the data and then therefore can upload what it wants as well. Understand what I'm saying? To me, this is just too dangerous to even bring this up at a time like this. Try to throw this at the population when they're not able to think with their right minds. And tell them that this little chip will save your life. It'll tell us when you got a virus, or it'll tell us before you even get COVID. Just so you can con a bunch of people into getting it in their hands, so that when time comes, once COVID isn't a problem anymore, you can start uploading God knows what to it. Super soldier stuff or any other thing that they're doing. I got another video coming out on that here today. I'm trying to get it done today. So the futuristic stuff. So the FDA, FDA did freeze the Johnson and Johnson one, but here we go. So blood clotting needs to be watched with all COVID vaccines. Let's start with that because, in all honesty, like I found a ton of blood clot stuff, but it didn't come under one. It came under all of the brands. So do 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 do. What's that? Already did that one. Okay, blood clotting needed to be watched with all COVID vaccines. I'm not going to read all this. I just want you to see where you can go to find these things. Um, this is actually from the Association of American Physicians and Surgeons. Okay. April 5th, more than a dozen countries temporarily stopped yeah, we just talked about that one, about AstraZeneca COVID vaccine due to blood clotting deaths and so on and so forth. Some patients experienced rare events of clots in the vein that drain blood from the vein, the venous sinus thrombosis. Yep. The number of reported events exceeds those expected, and casualty, although not confirmed, cannot therefore be excluded. However, given the rarity of the events and the difficulty of establishing baseline incidence, since COVID-19 itself is resulting in hospitalizations with here we go, thromboembolic complications. The strength of any association is uncertain, the agency said. Okay, so basically, well, wait a minute. Moderna products being rolled out here does not use mRNA. Instead, it uses chimpanzee adenovirus, whose DNA has been genetically engineered to code for the spike protein on the surface of the COVID-causing virus. The chimpanzee virus is able to enter human cells and uncode its DNA, but cannot replace it. Or, excuse me, cannot replicate it. Well, this is all so confusing. All three vaccines cause human cells to manufacture the spike protein, which then induces the immune system to make antibodies to that protein. If the person is exposed to the virus, the immune system will recognize the threat and mount a defense that should at least minimize the symptoms. The spike protein is just a fragment of a virus, so it, or the mRNA code that it codes for, cannot cause an infection. That's really confusing. 37 people have developed a rare platelet disorder from either Pfizer or Moderna shot. And OBGYN Gregory Michael died 3 days after receiving his Pfizer shot. This is what I'm talking about, guys, okay? These are the things that, like, this is right from the APS. So they're not trying to spike the ball with any stupid headline. Pay attention. Remember we just talked about the VAERS systems? Well, there was 309 cases of low platelets, thrombocytopenia reported as of March 26th. AAPS states that people should watch out for bruising, rashes, nosebleeds, or bleeding from gums. There are probably predisposing factors. There are probably predisposing factors. But AAPS notes that at present no way to screen for this in advance. As with any medical intervention, weigh the risks and benefits. Okay, so that's it. Basically, they just lay out what's been reported. No sugar, none of that stuff to scare you in the middle. I love that. There you go. Numbers only. Numbers only. Let's talk about DMX, because you know they had to put DMX in here, right? They sure did. They threw DMX in here like a lump on a log and said, DMX got his vaccine days before. They're trying to scare the black community into not getting this vaccine. I swear to God, but at the same time, trying to shove them into taking it with celebrities. Oh, all right. Here we go. DMX received COVID vaccine days before heart attack. Family says no drugs. Publishing the article, a lawyer who represented DMX told USA Today that DMX didn't receive the COVID vaccine a week before his heart attack. The lawyer also told this publication he wasn't sure if he received the vaccine before that period. MTO News received this information about DMX receiving the COVID-19 vaccine from a source related to the family and stands firmly on the CDC's report that there's yet to be a link between COVID vaccine and anyone's death. Yes, there has been. I just read to you multiple people who died that was linked to the COVID. Never mind. But anyway, it wasn't DMX. They can't even say DMX had a COVID vaccine, let alone had one a week before he died. Okay? There, squash, boom, debunked. Almost to the end. We're going to, after all these things I talked to you about today with these specific vaccines, what bothers me is we don't have a clue really about these side effects. We're just starting to learn about them in our own country and in our own people. And guess what we're going to do? We're going to give some away. That's right. We're going to share. We're going to share, probably sell, more like it, or trade. Remember that one, the one that was causing all the problems? The one we won't let go, we won't let them back into their Baltimore, Maryland laboratory because we let Johnson and Johnson take over it because of their problems. Yeah, AstraZeneca. We're gonna share 4 million AstraZeneca doses with Mexico and Canada from the US. You're welcome. Like, hello, really? Are you kidding me? I don't want it. Take it back. Of course, Mexico will receive 2.5 million doses. Canada will receive 1.5 million. Ensuring our neighbors can contain the virus is mission critical to ending the pandemic. AstraZeneca has millions of doses made in a U.S. facility and has said it would have had 30 million shots ready, but the company's shares rose. Oh, yeah, well, would have, except for it screwed up and had to destroy a bunch of them. But let's not talk about that. I know they're still pissed off. They got shut down for like a month. Two officials said the vaccine will be delivered in short order once the deal was completed. So we're not just giving it to them. Stop acting like we're some like charitable country that's saying, here, Mexico, we know you can't afford to vaccinate all of your people. And since we can vaccinate our people 3 times over, technically, we'll help you. We'll vaccinate a third of your people. I don't. She says we have access to 7. I don't like her name, Saki. Saki. You know what the things I think of when I say her name? And I'm gay. All right. So I don't like thinking of those things. More work to do. All right. Well, I'm just skimming to see if there's anything I missed before we finish up here because the only other these last two. The CDC warned of 3 new coronavirus vaccine side effects. That was a month ago, but still, let's see what they say. The most common side effects are pain at the injection site and brief flu-like symptoms, especially after the second dose, but researchers have learned more details about the vaccine in recent months. Let's see. One specific mild COVID vaccine side effect could appear days after the first or second dose. Skin issues, including redness or rashes. These reactions were observed after the Moderna jabs, especially the first dose. They're not a cause of concern and they tend to disappear on their own within a few days. The CDC made a few changes to its vaccine guidelines on Friday, including 3 new side effects, 6 potential adverse reactions, 2 are local pain and swelling, 4 are systemic, fever, chills, tiredness, and headache, as seen below. New guidelines include 9 possible vaccine side effects in addition to pain and swelling on the arm. As for systemic reactions, the CDC added muscle pain and nausea to the list. Muscle pain should not be confused with pain at the injection site. These reactions are indication that the immune system is responding to the perceived threat, the vaccine, and developing immunity. Coronavirus antibodies should begin to appear within about 2 weeks after the first jab. Maximum protection is obtained about 2 weeks after the second injection. So 2 weeks after the second injection, you have the maximum protection. It's a week after some people have gotten COVID because it's not at maximum protection yet. They're telling you that. Don't take these medications. There's like a list of medications not to take before you get your vaccination. And you can go to a link. This is on MSN, Microsoft News, but you can look it up. They have a link on the CDC's website where you can go check out all of the official coronavirus vaccine side effects. Last but not least, this just popped up as I was getting ready to do the video from yesterday. Pennsylvania woman is now among those to develop blood clots after receiving Johnson & Johnson COVID vaccine. This is the reason I wanted to bring this to you guys is this is a 26-year-old fitness instructor. Not on any meds. No history of anything to do with clotting. And she's got blood clots. There's no reason for her to have gotten, started getting blood clots, develop rare blood clots at 26 years old, except for the connection to this vaccine. So, the development of blood clots after receiving a single dose of COVID-19 vaccine was one of the 3 adverse cases that had been reported directly to the pharmaceutical company, officials said Wednesday. Woman checked into the emergency room with a severe headache about 1 week after being vaccinated. She was hospitalized in New Jersey despite being a Pennsylvania resident. The woman was identified as a fitness instructor, was discharged from the ER and given medication to treat her headache, but the pain continued, however, and the woman returned to the hospital a week later with abdominal discomfort and a rapid heart rate. While COVID was ruled out, lab tests found that the woman had a low platelet count in her blood. Scans discovered she also had several blood clots in major blood vessels in her brain, abdomen, and lungs. The woman was originally treated with a blood thinner called heparin, which helped increase her platelet count. However, she was then switched to a blood plasma treatment after the type of blood clot was determined. The woman spent 7 to 10 days in the hospital after being released with a prescription for anticoagulant to treat blood clots. She's the only patient among the 6 identified cases of blood clots to have recovered and been discharged. The rest died. Described as overweight but active, the woman had no history of blood clots and was not on any medication. How is she a fitness instructor and you guys are calling her overweight? Jesus. The advisory committee said that it needs additional time to make a decision on how the U.S. should proceed with administering the Johnson & Johnson vaccine. The committee is expected to reconvene in the next 7 to 10 days. I sure hope they're not poking people with that vaccine right now. Johnson & Johnson's vaccine, it says, listen, the CDC and the FDA issued a joint statement Tuesday urging states to halt the use of Johnson & Johnson vaccine until federal health regulators review 6 cases of rare and severe form of blood clot in people who received that shot. So right now, today being Friday, Tuesday, they asked for the hold. I'm imagining they got it. The 6 blood clot cases occurred among women between 18 and 48. Oh, that scares me. I'm not getting this, no. The type of blood clot they experience is called cerebral venous sinus thrombosis. This is the back of the brain where the blood. Anyway, it was seen in combination with low levels of blood platelets. Therapy differs from typical treatment of blood clots. Heparin could be too dangerous, and alternative treatments may be necessary. Anyone who received J&J's COVID vaccine and developed severe headache, abdominal pain,